My name is Dr. Michel Carter. I'm a physician. I've worked in hospital medicine for 30 years. And I want to start by telling you something that took me a long time to say out loud. Something that most doctors in my position don't say. Because the system we work inside doesn't really encourage it. In 3 decades of hospital work, I have sat beside more patients than I can count who looked at me with the same expression, confused, frightened, and asking some version of the same question. Why didn't anyone tell me this was coming? A 67-year-old retired teacher who walked into the ER with her first heart attack. No prior symptoms. No warning. She had been to her primary care doctor every single year for a decade. Cholesterol slightly elevated. She was told to watch her diet. Blood pressure borderline. She was told to reduce salt. And then one Tuesday morning, while making breakfast, her heart nearly stopped. Because the real damage, the damage that had been building inside her arteries for 20 years, was never once the subject of a real conversation. I've seen that story play out hundreds of times. Different patients, different names, different faces. The same story underneath: a 71-year-old man who couldn't walk to his mailbox without his legs cramping and going numb. He'd been told his circulation wasn't great for his age and given a prescription. Nobody explained to him why it was happening, what was driving it, or what he could do beyond taking a pill. He sat in my office and said, "Doctor, I feel like I'm disappearing slowly, and nobody can tell me why." A 63-year-old woman whose CAC score came back elevated and whose cardiologist spent 4 minutes with her before recommending a statin and sending her home with a pamphlet. She came to me 3 months later, still terrified, still confused, still not understanding what was actually happening inside her body or whether anything she did in her daily life made any difference at all. These patients changed me. Not all at once, slowly, over years of watching what happened when people received treatment without education, drugs without understanding, diagnoses without context. They took their medications. They followed the instructions, and many of them still got worse because the underlying processes, the real root causes, were never addressed. I spent the last decade of my career going much deeper into the research on cardiovascular disease than medical school or hospital practice had ever required me to go. Not just the pharmaceutical literature, which is where most continuing medical education lives, but the nutritional science, the lifestyle research, the studies on specific foods and nutrients and habits that don't get discussed in clinical rounds because they don't have billion-dollar companies funding their promotion. What I found surprised me. Not because the science was hidden or controversial. Most of it is sitting in peer-reviewed journals, available to anyone willing to look. But because the gap between what the research supports and what the average patient is actually told is enormous. The average patient is told what to take, almost never why the problem started, almost never what specific, affordable daily actions could change the trajectory of their vascular health in a meaningful way. This series is my attempt to close that gap. Over the next 15 videos, I'm going to walk you through everything I wish every one of my patients had known before they ended up in front of me. We're going to talk about the actual root cause of arterial disease. Not cholesterol, not blood pressure, but the damage that precedes both of them and drives everything downstream. We're going to talk about specific drinks, foods, and nutrients that have genuine clinical evidence behind them. We're going to talk about blood tests that give you a real picture of your cardiovascular risk, tests most people have never been offered. And we're going to build a complete daily protocol that you can implement starting tomorrow morning. I am not here to replace your doctor. Please, keep your appointments, take your prescribed medications, maintain those relationships. What I'm here to do is give you the knowledge to be a more informed participant in your own healthcare, to ask better questions, to understand what's happening inside your body, to make daily choices that actually move the needle on your cardiovascular health, not just manage the symptoms of damage that's already done. 30 years of hospital medicine taught me one thing above everything else. The patients who do best are not always the ones with the best doctors. They are the ones who understand their own bodies well enough to take their health seriously before the crisis arrives, not after. You're watching this, which tells me you're one of those people. Let's get to work. Your arteries are quietly failing right now. Not dramatically, not with chest pain or flashing warning lights, just silently, millimeter by millimeter, year by year, while you go about your day completely unaware. I know that sounds alarming. And it's meant to, because here's the reality that nobody in mainstream medicine is laying out plainly. By the time most people receive a serious cardiovascular diagnosis, the damage has been building for 20, sometimes 30 years. 2 or 3 decades of silent, invisible deterioration.
Here's the statistic I want you to sit with.
Sign appears.
By age 60, the average person has already lost 40 to 50% of their arterial flexibility. Half of the elasticity your blood vessels were designed to have gone, and most people feel almost nothing. A little more fatigue than before, slightly colder feet, maybe some leg cramping at night that they chalk up to aging. That's it. No sirens, no signals. Just the slow, quiet narrowing of the highways that carry oxygen and nutrients to every single cell in your body. And then one day, something goes catastrophically wrong. A clot breaks loose. An artery that's been narrowing for years finally closes completely. A stroke, a heart attack, a fall caused by poor circulation that sends someone to the hospital and changes their life forever. I've spent years going deep into the cardiovascular research, not just reading abstracts, but tracing studies back to their sources, talking to people who've worked in vascular medicine, and paying close attention to what actually moves the needle versus what just sounds good. And what I've found is that there is a massive gap between what the research actually supports and what most people are being told. Not because doctors are dishonest, most of them are genuinely trying to help, but because the medical system is built to treat crises, not prevent them. It's built to respond to the moment when something breaks, not to address the 20-year process that led to the breaking. What I'm going to give you over the next 15 parts is something different, a complete, practical, science-grounded series on how your arteries actually work, what damages them, what heals them, and what you can start doing today, not next month, not after your next checkup. Today, to change the trajectory of your cardiovascular health, we're going to talk about the root cause that almost nobody addresses. We're going to talk about specific drinks, foods,
Today,
and nutrients
to change the
strong
trajectory of your
clinical evidence
cardiovascular
behind
health.
We're going to talk about the blood
cause that
tests
almost
your
nobody
doctor
addresses.
probably isn't ordering.
We're going to talk about
that would give
specific
you a much
drinks,
clearer
foods,
picture
and
of
we're
the
going to
nutrients
build
that
a
have
practical
clinical
daily
evidence
protocol
behind them.
that
We're
takes
going to talk about
15
the blood
minutes
tests
and
your doctor
costs
probably
almost
isn't
nothing.
ordering that would give
But
you a much clearer
before any of
picture
that,
of your real risk.
I need to explain something fundamental, something that changes the way you understand every cardiovascular symptom you've ever experienced. It starts with a single layer of cells inside your arteries, cells so thin they're almost invisible, and so important that when they fail, everything else eventually fails too. That layer is called the endothelium. And in the next part, we're going to go deep on exactly what it does, what damages it, and why fixing it is the key to everything else. If you understand the endothelium, you understand cardiovascular disease in a way that most people, including most patients and honestly many doctors, never fully grasp. Here's my challenge to you right now. Don't wait until something goes wrong. Don't wait until you're in a hospital bed wondering what you could have done differently. The information I'm about to share over this series is actionable, affordable, and grounded in real science. All it requires is that you actually use it. Subscribe if you haven't already, because we're going deep on this starting right now. Your arteries have been working for you every second of every day since before you were born. It's time to work for them. Picture the inside of your artery, not the outside, the muscular wall that you might visualize when someone talks about blood vessels. The inside. Right at the very center, where the blood actually flows, there is a single layer of cells coating the entire inner surface of every artery in your body. Every coronary artery feeding your heart, every carotid artery running up to your brain, every femoral artery supplying your legs, every single one of them is lined with this one-cell-thick tissue. It's called the endothelium, and it is, without exaggeration, one of the most metabolically active and critically important tissues in the human body. If you stretched out the endothelium from a single adult human and laid it flat, it would cover an area roughly the size of a tennis court. One cell thick, covering an area that large, doing an extraordinary amount of work, every second of every day, without rest, without breaks, for your entire life. What does it do? The endothelium is not just a passive lining, it's an active organ. It regulates blood flow by controlling whether your arteries dilate or constrict. It prevents blood clots from forming on arterial walls. It monitors inflammation and sends chemical signals to your immune system. It controls the passage of nutrients and waste products between the blood and surrounding tissue. And most critically, at least for the purposes of this series, it produces a molecule called nitric oxide. We're going to spend an entire video on nitric oxide later in this series because it deserves that level of attention. But for now, understand this. Nitric oxide is the primary mechanism by which your arteries stay relaxed, open, and flexible. When your endothelium is healthy and producing adequate nitric oxide, your blood pressure tends to stay in a healthy range. Clots are less likely to form. Inflammation is controlled. Blood flows freely. When the endothelium is damaged, and this is the critical piece, nitric oxide production drops, and a cascade begins that leads, step by step, to almost every serious cardiovascular problem you can name. Here's how the cascade works. When endothelial cells are injured, they become inflamed. The surface of the artery, which is normally smooth and repellent to blood components sticking to it, becomes rough and sticky. Your immune system detects the damage and sends inflammatory signals. White blood cells begin infiltrating the arterial wall. Then your body does something that is actually quite brilliant in the short term and catastrophic in the long term. It tries to repair the damage. It sends cholesterol, specifically LDL cholesterol, to patch the injured area, along with calcium and proteins that form a hard structural scaffold. This patch is what we call plaque. I want you to pause on that for a moment because it reframes everything. Plaque is not an attack on your arteries. Plaque is your body's attempt to heal them. It is a repair response, the biological equivalent of your skin forming a scab over a wound. The problem is that if the wound never stops being re-injured, the repair process never stops either. And what began as a thin patch slowly becomes a thickening, hardening, narrowing buildup that reduces blood flow, stiffens arterial walls, and creates the unstable, rupture-prone plaques that cause heart attacks and strokes. This is why treating cholesterol alone fundamentally misses the point. Lowering LDL without addressing the endothelial damage is like cleaning up the scabs without addressing the thing that keeps cutting you. The body will just keep sending more cholesterol to patch more wounds. The root cause, the ongoing damage to the endothelium, keeps operating underneath. So what damages the endothelium in the first place? The list is longer than most people expect. Chronically elevated blood sugar is one of the most potent. Oxidative stress from processed foods. Chronic inflammation from a poor diet or high stress. Smoking. Insufficient sleep, and the simple process of aging, which reduces the endothelium's capacity to repair itself and produce nitric oxide. The good news, and there is genuinely significant good news here, is that the endothelium has remarkable regenerative capacity. It can heal, it can increase nitric oxide production again. Arterial stiffness in many cases is measurably reversible. This is not wishful thinking. This is what the clinical evidence shows when people make the right changes consistently over time. In the next video, we're going to go deep on one of the most significant drivers of endothelial damage, one that is hiding in plain sight in almost everyone's diet, and one that most people have been told is perfectly fine. Get ready, because some of what you're about to hear is going to challenge assumptions you've held for years. I want to start this video with a number. A single number that, once you really understand what it means, will change the way you look at almost everything you eat. Your entire bloodstream, all 5 liters of it, every drop of blood circulating through your body right now should contain no more than approximately 4 to 5 grams of glucose at any given time. That is roughly 1 teaspoon of sugar. 1 teaspoon in your entire circulatory system. That's the target. That's what your body considers normal and healthy. Now let's look at what the average person is actually consuming. A typical diet in most developed countries gets between 45 and 65% of its total calories from carbohydrates, and a large portion of those are refined carbohydrates. White bread, white rice, pasta, breakfast cereals, sweetened drinks, fruit juices, snack foods. When you calculate the sugar equivalents being introduced into the bloodstream over the course of a typical day, you arrive at something in the range of 50 to 100 teaspoons of glucose equivalent, against a background level of 1. And yet, if you went to your doctor today and had your fasting blood sugar tested, there's a good chance it would come back completely normal. How? How can someone put 70 or 80 teaspoons of sugar equivalent into their blood daily and still have a normal reading? The answer is insulin. And understanding insulin is key to understanding why millions of people have severely damaged arteries and have no idea. Insulin is produced by your pancreas, and its job, among many other things, is to clear glucose from your bloodstream as fast as possible and store it in muscles if they're glycogen depleted, in the liver, and eventually, when those stores are full, as body fat. Every time blood sugar spikes, insulin spikes in response, rapidly clearing the glucose before it can reach dangerous levels in the blood. The blood sugar test comes back normal. The doctor says, everything looks fine. And the person continues, here's the problem. While insulin is doing its heroic job of keeping blood sugar in range, something else is happening that doesn't show up on any basic blood panel. Every single spike in blood glucose, even the ones that insulin quickly clears, causes a brief but intense wave of damage to the endothelial lining of your arteries. The mechanism is called oxidative stress. Glucose, in high concentrations, generates free radicals, unstable molecules that attack and damage cellular structures. The endothelium, with its enormous surface area and constant blood contact, is particularly vulnerable. Each glucose spike sends a pulse of oxidative damage through miles of delicate arterial lining. There is also a process called glycation. Glycation happens when glucose molecules attach themselves to proteins and fats, essentially gluing themselves to structural molecules in your body and altering their function. Glycated proteins in arterial walls become stiff and dysfunctional. Glycated LDL cholesterol becomes oxidized and far more likely to embed in arterial walls and trigger plaque formation. A compound called HbA1c, which your doctor may have tested, is actually a direct measure of how much glycation has occurred in your red blood cells. High HbA1c means high glycation throughout your body, including your arteries. This process doesn't announce itself. There's no acute pain, no obvious symptom, no alarm. It just happens quietly, relentlessly every time blood sugar spikes. Over 5 years, 10 years, 20 years of high carbohydrate eating, the cumulative damage to the endothelium is profound. Now here is the part that should concern you most. The pancreas can only sustain this overproduction of insulin for so long, typically 15 to 20 years before insulin sensitivity begins declining and the system starts breaking down. Blood sugar levels that were normal for years begin creeping up. The person is told they're pre-diabetic, then diabetic. But by that point, the arterial damage from 2 decades of glucose spiking and glycation has already occurred. This is why I say the problem starts 20 years before the diagnosis. The diagnosis is almost a formality. It's just the moment when the body's compensation mechanisms finally fail visibly. The good news is compelling. A low-carbohydrate diet has been shown in multiple studies to remove approximately 40% of liver fat within just 14 days. Arterial inflammation markers drop within weeks. Blood pressure often improves significantly within months. The endothelium, given the right environment, begins to heal. You don't need to be perfect. You don't need to eat 0 carbohydrates for the rest of your life. But reducing refined sugars and starches dramatically and doing it consistently is one of the most powerful interventions available for cardiovascular health. More powerful, in many studies, than any single drug or supplement. And it starts with understanding exactly what's been happening inside your arteries all along. Before I let you go, I want to take just a moment. Because if you've watched this far through all 3 of these videos, you've already done something most people never do. You've actually tried to understand what's happening inside your body, not just the symptoms, not just the number your doctor circled on a lab report, the real mechanism underneath. That matters. And I don't want you to stop here, because here's the truth. What we've covered so far is the foundation, the endothelium, the root causes, the damage that builds silently over decades. That understanding is essential. But the next part of this series is where it gets genuinely actionable. Specific drinks, specific nutrients, exact protocols with dosages and timing. The stuff you can actually do tomorrow morning that changes what happens inside your arteries over the next 30 days. And I want to make sure you're there for it. So if this has been useful, if something in these 3 videos made you see your cardiovascular health differently, please take 2 seconds and hit like and subscribe. It tells me this is worth continuing, and it makes sure the next video finds you when it goes up. More importantly, drop a comment below right now. Tell me you want part 2. Tell me what's been most useful so far, what questions you still have, what you're dealing with that you want me to address. I read those comments. They shape what I cover next. There is significantly more important information coming. Information that I genuinely believe could change the trajectory of your health, but I need to know you want it. Comment below. I'll make it and I'll upload it for you. I'll see you in part 2.